There are a lot of algae in the marine environment, some of which are capable of producing toxins. However, this is a field that is largely unexplored. Gyrodinium aureolum is a dinoflagellate that is currently under study. It has been a cause of large-scale mortality in the marine environment, involving a variety of species, including fish and various invertebrates. In regards to its pathogenesis, toxin production is suspected in addition to bloom-associated anoxia. In fish, the toxin has a tropism for the gills and the intestine. Blooms are associated with a certain set of conditions, including an upwelling of nutrient-rich water, low turbulence, elevated temperatures, and abundant light. Toxin production is also dependent on the availability of biotin. Clinical signs within affected fish include abnormal behavior and darkened skin. Examples of abnormal behavior include disequilibrium. On gross examination, the gills are congested. Histologically, there's also widespread degeneration and necrosis of the epithelium throughout the intestinal mucosa and the gill lamellae. Microcystis is a genus of cyanobacteria that are responsible for toxic blooms involving the production of microcystin. This toxin is responsible for NetPen liver disease. Microcystin specifically targets hepatocytes. Blooms typically occur in the summer in areas where eutrophication is a problem. In regards to epidemiology, blooms are typically associated with chronic persistent mortality. In some areas, cumulative mortality can reach up to 90%. The hepatocellular changes can persist for months, so if a diagnosis is made in the winter, it's likely the result of summer exposure. This is considered a disease of salmonids in both the freshwater and the marine environment. However, it's likely that the toxin has a freshwater source. Ancillary testing includes gas chromatography and mass spectrometry. Clinical signs within affected fish include darkened skin and lethargy. On gross examination, the fish may have a small yellow friable liver. Histologically, hepatocytes exhibit a number of changes, including megalocytosis, karyomegaly, vacuolar degeneration, and necrosis, with widespread hepatocellular dissociation. Concurrent with the degenerative changes are a number of regenerative changes with associated bile preductular cell hyperplasia. There's also an abundance of pigment-laden macrophages containing ceroid. This is evidence of increased cell turnover. Within sections of the liver, there's widespread vacuolar degeneration and perivascular inflammation. On closer examination, there's marked degeneration and necrosis of most of the hepatocytes in section. The green arrows are highlighting the few hepatocytes that are still viable. This is consistent with acute toxicosis. This is a section of the liver from another fish that was exposed to microcystin. You'll notice there's marked disruption of the tissue architecture, and the hepatocytes are deeply basophilic. On closer examination, there are large aggregates of pigment-laden macrophages. These are labeled in red. This is evidence of increased cell turnover. Within the hepatocellular trabeculae, there's marked biliary preductular cell hyperplasia. This is labeled in green. This is evidence of hepatocellular regeneration. As previously mentioned, bile ducts and hepatocytes share a common progenitor cell. Other changes include widespread hepatocellular degeneration and dissociation, wherein hepatocytes also exhibit a considerable variation in cell size. Closer still, you'll notice that many of the hepatocytes have enlarged nuclei or multiple nuclei. These are labeled in red. All of the changes in the second fish are consistent with chronic toxicosis. Tail dermatitis is a condition that occurs in seahorses. Seahorses have a prehensile tail, so they often latch onto things within their environment. If there's an abrasive substrate in their environment, this can result in tail trauma. Epidermal ulceration will often progress to secondary infection. The infection can involve bacteria, fungi, or protozoa. On gross examination, you'll see areas of ulceration on the tail. Histologically, you'll see ulcerative dermatitis. This can be associated with pleocellular inflammation, necrosis, dystrophic mineralization, and localized infection. Localized infections can progress to systemic infections. Within sections of the tail, there's an extensive area of epidermal ulceration, which is associated with secondary bacterial infection. There's also involvement of a vessel deep within the underlying tissue. This is a sagittal section of the head of a seahorse. If you look at the gills, you'll notice that they're very congested and hypercellular. On closer examination, there are large numbers of bacterial emboli within the lamellar capillaries. This is evidence of systemic infection stemming from the ulcerative lesion on the tail. The bacterial emboli are labeled in red. Epitheliocystis is an umbrella term for a group of parasitic bacteria that form cysts within the cytoplasm of the lamellar epithelium. These bacteria generally belong to Chlamydiae and Proteobacteria. In regards to epidemiology, transmission is either direct or indirect. Various species of fish in the freshwater and marine environment are susceptible to infection. However, each species of bacteria seems to be fairly host-specific. The image to the right is an example of some of the gill lesions that can occur with heavy infections. Notice the pale mottling and the scattered foci of hemorrhage and congestion. Clinical signs associated with infection depend on the parasite load. Mild infections are generally asymptomatic. When there's a heavy parasite load, the fish can exhibit signs of respiratory distress. On gross examination, the gill filaments are thickened. Histologically, there are large numbers of intracytoplasmic bacterial colonies within the lamellar epithelium. This can be associated with lymphohistiocytic filament bronchitis and hyperplasia of the lamellar epithelium. This is an example of epitheliocystis along the base of the gill lamellae. Notice the absence of inflammation or any other signs of tissue reaction. As with terrestrial vertebrates, sunburn can occur in fish and is the result of excessive UV exposure. Normally, fish move away from damaging radiation. However, in a captive setting, options may be limited. Predisposing factors in the environment include high stocking density, shallow water, a lack of shade, high altitude where the air is thinner, clear water, and exposure to phototoxic chemicals which increase photosensitivity. When compared to mammals, fish are more prone to UV damage for a variety of reasons. In fish, the pigmented cells are confined to the dermis. The epidermis is devoid of melanomacrophages, which are responsible for absorbing ultraviolet rays. Fish also lack a keratinized layer. As a consequence, the cells of the epidermis are completely exposed to UV radiation. And given that all of the layers of the epidermis are viable, it's particularly prone to injury. In clear water, UVB can penetrate to a depth of up to a meter. Suspended particulates can reduce the level of penetration. So although a clear pond may be aesthetically pleasing for koi enthusiasts, it can be harmful for the fish. The images on the right are meant to contrast the difference between a clear pond and a murky pond. In the image above, the fish is likely more content with the level of UV protection. Fish with sunburn are fairly recognizable. On gross examination, the lesions will typically occur on the head, the dorsum, the tail, the pectoral fins, and the dorsal fins. These are the tissues that are exposed to sunlight. Lesions include frayed fins, patchy epidermal pallor, and in severe cases, epidermal ulceration. Histologically, there may be swelling of the Malpighian cells. Affected cells also contain pycnotic nuclei and a perinuclear halo. This can progress to necrosis of the Malpighian cells, and in severe cases, necrosis of the underlying stratum spongiosum. Eventually, this will result in ulceration of the epidermis with secondary infection. This can involve bacteria, oomycetes, and other organisms within the environment. The image on the right is an example of a koi with severe sunburn along the dorsal aspect of the body. Notice the red discoloration. Here is an example of sunburn before the invention of color photography. You'll notice that the epidermal cells have pycnotic nuclei and a clear perinuclear halo. There's also patchy necrosis of the spongy dermis, resulting in a lifting of the epidermis from the underlying tissues. Necrosis of the spongy dermis is labeled in red. One of the issues with fish pathology is that many of the conditions were described decades ago, and given the lack of interest in the field, many of the diagnoses have remained unchallenged over the years. It is my view that the lip fibroma is an example of this. So the lip fibroma is classified as a neoplasm that is believed to be virally mediated. Early studies identified the presence of retroviral-like particles using electron microscopy. However, the particles are not always present, so it may be a red herring. Moreover, this condition has only been described in fish that are held in captivity. It is my belief that this condition is actually a hamartoma resulting from repeated trauma to the face, which is common when you're stuck in a glass box. A hamartoma is defined as a non-neoplastic growth that consists of a disorganized mixture of cells and tissues that are normally found in the area of the body where the growth occurs. This condition has only been described in angelfish in the freshwater environment. On gross examination, there's a nodular proliferation on the labial mucosa. This nodule is pale pink, firm, exophytic, and irregular. Histologically, it's composed of various elements, including fibroblasts, collagen, bony proliferation, and epithelial hyperplasia. It's often associated with the displacement of teeth. The image to the right is an example of an angelfish with nodular proliferations on the maxilla and mandible, which is characteristic of this condition. Here is a section of a lip fibroma. You'll notice that there's marked proliferation of various elements that you would normally find in the lip of a fish. Although the growth is somewhat disorganized, it is by no means uncontrolled. The tissues are well differentiated, and there's even preservation of the outward-facing orientation of most of the teeth. These are labeled in green. Moreover, the tissues within the mass are confluent with the surrounding tissues, so much so that it can be difficult to tell where the mass ends and the rest of the face begins. It's also worth noting that in a neoplasm, the neoplastic population is fairly homogeneous. Although neoplasms can consist of a variety of cell types, it would be unusual for the neoplasm to include tissues that are completely different in embryological origin, like skin and bone. Such neoplasms are rare and typically arise from totipotent or pluripotent cells, like the teratoma. Here is a section of a fibroma from a terrestrial vertebrate. Although benign, this is an actual neoplasm. You'll notice that the mass consists of a single cell type, that being the dermal fibroblast, and it is associated with collagen deposition. The margins of the neoplasm can also be delineated from the surrounding tissue. In short, the neoplasm is very much a separate entity and has little confluence with the surrounding tissues. Here is an example of a fibroadnexal hamartoma in a dog. Notice the similarities between the fibroadnexal hamartoma and the lip fibroma. The walleye retrovirus is responsible for the condition known as walleye dermal sarcoma. This is a single-stranded RNA virus of the family Retroviridae. The virus has oncogenic potential by causing perturbations of the cell cycle. It integrates a DNA copy of itself into the host genome, thus causing neoplastic transformation. The tumors will regress spontaneously. They typically arise in the autumn and resolve in the summer. In regards to epidemiology, transmission is either direct or indirect. This is a disease of walleye in the freshwater environment. Ancillary testing includes electron microscopy, in situ hybridization, and immunohistochemistry. The image to the right is an example of tumor growth in a walleye. You'll notice that most of these tumors have areas of hemorrhage along the surface. This is a result of abrasion, given the exophytic nature of the mass. On gross examination, there are large numbers of pale, firm, exophytic, and irregular masses within the skin. These can be singular or multinodular. The mass is associated with ulceration of the overlying epidermis, and so there's often concurrent hemorrhage and necrosis. Histologically, there's a sarcoma arising from the stratum spongiosum. The cell of origin is the dermal fibroblast. The mass is composed of neoplastic mesenchymal cells. These cells are spindle-shaped and arranged into streams and whorls. The mass is generally well demarcated. It's rarely invasive and non-metastatic. Here's a section of the walleye dermal sarcoma. Notice that the neoplasm is arising from within the spongy dermis. The neoplastic population has enveloped one of the scales. This is labeled in green. Given the exophytic nature of the mass, there is ulceration of the overlying epidermis, which is associated with inflammation and dystrophic mineralization. This is labeled in red. As with the walleye dermal sarcoma, the white sucker papilloma is believed to be an example of viral-associated neoplastic transformation. In some cases, retrovirus-like particles have been identified using electron microscopy. However, this is an inconsistent finding. Moreover, the presentation of proliferative lesions is quite variable. This has led some to believe that there are a number of different causes of epidermal proliferation, and all of these unrelated conditions have been misdiagnosed as a single disease. Papilloma formation is characterized by a gradual increase in the size and density of papillomatous proliferations. The lesions will often regress spontaneously. In regards to epidemiology, transmission is either direct or indirect. This is a disease of white suckers in the freshwater environment. Ancillary testing includes electron microscopy. The images to the right are examples of some of the epidermal proliferations that can occur. On gross examination, you'll often find nodules on the lips and papillomas and plaques on the skin. These can vary in their presentation. They're often pale, firm, exophytic, smooth to rugose, and multifocal to coalescing. Histologically, the nodules arise from the epidermis. The proliferations are composed of Malpighian cells. Neoplastic epithelial cells are arranged in sheets and papillary projections with dermal papillae. The neoplastic cells generally exhibit a loss of polarity, meaning they're no longer properly oriented within the epidermis. The mass is typically well demarcated. It's non-invasive and non-metastatic. In some cases, there are leukocytic infiltrates with the neoplastic epidermis. Here's another example of a monochromatic image that was printed on canvas. You'll notice that the epithelial population to the left is fairly homogeneous, with an absence of mucous cells and club cells. The epidermis is thickened and the Malpighian cells exhibit a loss of polarity. This is consistent with neoplastic transformation. Compare that to the population on the right, which is considered normal.